Understanding lupus, a simple guide for everyone. Lupus is a complex condition that affects many parts of the body. It's an autoimmune disease, which means the immune system, which normally protects us from infections, mistakenly attacks healthy tissues. While this might sound scary, it's important to understand that with the right care, many people with lupus live full and healthy lives. Immune system confusion. Normally, the immune system fights off invaders like bacteria and viruses. In lupus, the immune system gets confused and attacks the body's own tissues, thinking they are threats. Triggers. Lupus is not caused by one thing. Instead, it can be triggered by genetics. If someone in your family has lupus or another autoimmune disease, you might have a higher chance of developing it. Environment, sunlight, infections, or even stress can trigger lupus symptoms. Hormones. Lupus is more common in women, especially during childbearing years, suggesting hormones like estrogen may play a role. Age. It can develop at any age, but is most common between 15 and 45 years. Gender. Women are affected about 9 times more often than men. Ethnicity. Lupus is more common in people of African, Asian, and Native American descent. Lupus is known as the great imitator because it can mimic many other diseases, making it hard to diagnose. Here's how it might show up. Skin. A butterfly-shaped rash on the face is common. Sun sensitivity can cause rashes after being in sunlight. Joints. Pain, stiffness, and swelling, especially in the morning. Lupus can be confused with arthritis. Organs. Kidneys. Lupus nephritis can cause kidney damage. Symptoms might include swelling in the legs or blood in the urine. Heart and lungs. Inflammation can lead to chest pain or shortness of breath. Blood. Anemia, low red blood cells, clotting issues, or low platelets. Brain and nervous system. Headaches, dizziness, depression, or even seizures in severe cases. Lupus is a chronic condition, which means it lasts a long time, but it doesn't have to control your life. Understanding how to manage it can make a huge difference. Medication. Anti-inflammatory drugs for joint pain and swelling. Antimalarials, like hydroxychloroquine to reduce flares and protect organs. Steroids, for severe symptoms, but these are used cautiously due to side effects. Immune suppressants, for more serious cases to calm down the overactive immune system. Lifestyle changes. Avoid too much sunlight, use sunscreen. Maintain a healthy diet rich in fruits, vegetables, and lean protein. Manage stress through relaxation techniques like yoga or meditation. Regular exercise to keep joints flexible and improve overall health. Regular checkups. Monitoring symptoms and organ function with your doctor helps catch problems early. Diagnosis delay. Because lupus mimics other conditions, it can take years to get the right diagnosis. Flare-ups. Symptoms can suddenly worsen. This is called a flare. Learning to recognize early warning signs can help. Chronic conditions can lead to anxiety or depression. Support groups and counseling can help. Let's clear up some common misunderstandings. Myth: lupus is contagious. Fact: lupus is not contagious. You cannot catch it from someone. Myth: lupus only affects women. Fact: while it's more common in women, men and children can have lupus too. Myth: people with lupus can't live normal lives. Fact: many people with lupus manage their symptoms and live full lives. Research: scientists are working to better understand lupus and develop more effective treatments with fewer side effects. Support: organizations like the Lupus Foundation of America provide resources, support groups, and advocacy. Living well. With advancements in medicine and awareness, people with lupus have more tools than ever to manage their condition. Lupus is a challenging condition, but knowledge is power. By understanding the disease, its effects, and how to manage it, we can help those living with lupus feel supported and empowered. Whether it's spreading awareness, supporting research, or simply being kind to someone with a chronic condition, we all have a role to play. Thank you for listening. If you have any questions or know someone who could benefit from this information, let's keep the conversation going through comments and share, subscribe.